Every single day, thousands of people over 60 wake up feeling perfectly fine, and by lunchtime, they're in the emergency room, not because of something dramatic, not because they felt sick the night before, because of something they did in their bathroom that morning. Something so common, so automatic that you've probably done it 100 times this month without thinking twice about it. And here's what makes this really concerning. The research shows that this one bathroom habit is connected to almost 40% of morning heart events in older adults. That's according to data published in the European Heart Journal. But almost nobody talks about it with their doctor because it seems too ordinary, too embarrassing, or too unimportant to mention. I'm Dr. Michael Kent, and I've been a cardiologist for over 20 years. In the next 15 minutes, you're going to learn exactly what this bathroom habit is, why it becomes dangerous after age 60, the warning signs your body gives you that most people miss completely, and most importantly, the simple adjustments that can protect you starting tomorrow morning. If you're over 50 or you know someone who is, what you're about to hear could genuinely make a difference. Now, let me be very clear about something from the start. This isn't about scaring you. This is about understanding your body better. Because when you understand what's actually happening inside your body during those morning hours, the changes you need to make are actually pretty straightforward. So let's talk about timing first, because timing is everything here. Between 6 a.m. and noon, your body goes through some significant changes that most people never think about. Your blood pressure doesn't just gradually rise when you wake up, it jumps. In most people over 60, blood pressure can increase by 20 to 30 points within the first few minutes of waking. Your heart rate speeds up, your blood gets a little thicker because you've been lying down for hours without drinking anything. And your stress hormones, things like cortisol and adrenaline, they surge to help you transition from sleep to being awake. This is all completely normal. Your body is designed to do this. The problem isn't the surge itself. The problem is what you do during the surge. Think about your typical morning for a second. The alarm goes off. Maybe you hit snooze once or twice. Eventually you get up, probably pretty quickly. You walk to the bathroom, you sit down, and then here's the critical moment. You strain, you push. Maybe you hold your breath a little bit without even realizing it. You're trying to have a bowel movement, and if things aren't moving easily, you push harder. Does that sound familiar? Of course it does. It's what everybody does. But here's what's actually happening inside your body when you do that. When you strain, when you push hard and hold your breath, something called the Valsalva maneuver happens. Your chest pressure increases dramatically. This temporarily reduces blood flow back to your heart. Then, when you finally breathe again, there's a sudden rush of blood and your blood pressure spikes even higher than it already was. For a young person with healthy, flexible arteries, this usually isn't a problem. But after 60, your arteries are stiffer. Many people have plaque buildup they don't even know about. Your body's ability to regulate these sudden pressure changes isn't as quick as it used to be. And if you're straining during that morning surge when everything is already elevated, you're stacking one pressure increase on top of another at the exact moment when your heart is most vulnerable. A study from Japan followed more than 40,000 older adults for a decade. They found that people who regularly strained during morning bowel movements had significantly higher rates of heart attacks, strokes, and dangerous heart rhythm problems, especially in those first 2 hours after waking up. The researchers called it the morning danger window. Now, before you start thinking this is rare, let me tell you it's not. Constipation affects nearly half of all adults over 60. That's millions of people straining in their bathrooms every single morning during the most vulnerable time of their day without realizing the risk they're creating. Let me paint a picture you might recognize. You wake up, you feel that urge or that pressure, you go to the bathroom, you sit down, and nothing happens right away. So you push a little, still nothing, you push harder, maybe you lean forward, maybe you tense your whole body. You might even hold your breath for 10, 15, 20 seconds without realizing it. You're just trying to get things moving. And when it finally works, you feel relieved. Mission accomplished, right? Except what just happened is your blood pressure probably shot up by 40 or 50 points in a matter of seconds. Your heart had to work much harder. And if there's a vulnerable spot in one of your coronary arteries, that's when problems can start. Here's what most people don't realize. You can be straining and not even know it. You might think you're just sitting there normally, but if you're holding your breath, if your face is getting a little red, if you're tensing your stomach muscles, that's straining. and it counts. So let's talk about the warning signs your body gives you. These are things you might notice and brush off as just getting older or not sleeping well. But they matter. First, if you ever feel dizzy or lightheaded right after using the bathroom in the morning, that's a sign. Your blood pressure is swinging too dramatically. Your body is telling you it's struggling to keep up with the changes. Second, if you feel your heart racing or skipping beats during or right after a bowel movement, pay attention to that. That's not normal. That's your heart rhythm getting disrupted by the pressure changes. Third, any chest discomfort, tightness, or pressure during or after straining, even if it's mild, even if it goes away quickly, even if you're not sure if it's really your chest or maybe just indigestion, take it seriously. Fourth, if you break out in a cold sweat for no clear reason, or feel suddenly nauseous while you're in the bathroom, that can be your body's way of saying your heart isn't happy. And fifth, if you feel completely exhausted after a bowel movement, like it took everything out of you and you need to sit and recover, that's significant. That means your body is working way too hard for something that should be relatively effortless. Now, you might be thinking, okay, I understand the problem, but what am I supposed to do about it? I can't just not go to the bathroom. You're absolutely right. So let's talk about practical solutions. Real things you can do starting tomorrow that make a genuine difference. First thing, and this is probably the most important single change, never strain. If you sit down and nothing happens easily within a minute or two, don't push. Just stop. Stand up, walk away, try again later. I know that feels inconvenient. I know it feels like you're just wasting time, but forcing it is riskier than waiting. Second, when you do sit down, breathe. Keep breathing normally the entire time. Don't hold your breath. If you catch yourself holding your breath, that's your signal that you're straining and you need to stop. Third, time it differently if you can. The absolute highest risk time is the first 30 minutes after you wake up. If you can wait 30 to 60 minutes, if you can have some water, move around a little bit, let your body fully wake up before you go, that's much safer. Your blood pressure will have stabilized, your blood will be less thick, and your heart will be in a better place to handle any changes. Now let's talk about preventing the problem in the first place, because if you're not constipated, you won't need to strain. And this is where simple daily habits make a huge difference. Water is critical. Most older adults don't drink enough water. You need at least 6 to 8 glasses a day, every day. And here's a specific tip. Drink a full glass of water right when you wake up, before you even get out of bed. Keep water on your nightstand. This starts rehydrating you immediately and helps soften everything naturally. Fiber is your friend. You want to aim for 25 to 30 grams of fiber every day. That means fruits, vegetables, whole grains, beans. If you're not getting enough from food, talk to your doctor about a fiber supplement. Start slow though, because too much fiber too fast can actually make things worse. Movement matters. A 20 or 30-minute walk every day helps keep your digestive system moving regularly. You don't need to do anything intense, just regular, gentle movement. And here's something many people don't know. The position you sit in actually matters. If you use a small stool to prop your feet up while you're sitting on the toilet, so your knees are higher than your hips, that changes the angle and makes everything much easier. You can buy these stools online for like $20, and for some people, it makes a significant difference. Let's talk about medications for a minute, because this matters more than most people realize. Some very common medications can cause constipation or make it worse. Blood pressure medications, certain pain medications, antidepressants, antihistamines, iron supplements, calcium supplements. If you started having constipation issues around the same time you started a new medication, that might not be a coincidence. Don't stop taking anything without talking to your doctor, but definitely have that conversation. Sometimes there are alternatives. Sometimes adjusting the dose helps. Sometimes just knowing the cause helps you manage it better. Here's something else that's important. If you take blood pressure medication, ask your doctor if you should take it at night instead of in the morning. Recent research shows that taking blood pressure medication at bedtime can provide better protection during those vulnerable morning hours. Not everyone should do this. It depends on your specific situation, but it's worth discussing. Now, what about that morning routine overall? Because the bathroom situation is part of a bigger picture. How you wake up and start your day matters for your heart. When your alarm goes off, don't jump out of bed. Take a minute, lie there, breathe, let yourself wake up gradually. Then sit up slowly. Sit on the edge of your bed for 2 or 3 minutes before you stand. This gives your blood pressure time to adjust. It reduces dizziness, reduces falls, and reduces stress on your heart. When you do stand up, do it slowly. Hold on to something sturdy. If you feel dizzy at all, sit back down and wait another minute. There's no prize for rushing. For the first 30 minutes after you get up, keep everything low-key. No heavy lifting, no intense exercise, no running upstairs, no going out into extreme cold without warming up first. Just gentle, easy activities. Get dressed slowly. Make some breakfast. Drink that water. Let your body fully transition into being awake. One more thing about the bathroom specifically. Temperature matters. A lot of older adults have the bathroom fan on, the window cracked, and it gets cold in there. Cold causes your blood vessels to constrict, which raises your blood pressure even more. Keep the bathroom comfortably warm, and never lock the door if you're home alone. I know that seems like odd advice, but if something did happen, you want to make sure help can reach you. Let's talk about what to do if you ever feel symptoms. If you're in the bathroom and you suddenly feel chest pain or pressure, or you feel severely dizzy, or your heart starts racing in a scary way, or you break out in a cold sweat, here's what you do. Stay calm if you possibly can. Stand up carefully, get out of the bathroom, sit or lie down somewhere safe, and call for help immediately. Call 911 or have someone else call if there's anyone nearby. Don't wait to see if it passes. Don't convince yourself it's probably nothing. When it comes to heart symptoms, it's always better to get checked and have it be nothing than to wait and have it be something serious. Every cardiologist I know has seen patients who waited too long because they didn't want to bother anyone or they felt embarrassed about the circumstances. Please don't let embarrassment stop you from getting help. Here's the really good news in all of this. These changes are simple. You don't need expensive equipment. You don't need a complicated medical treatment. You just need to understand what's happening and make some adjustments to your daily routine. Drink more water. Eat more fiber. Move your body regularly. Don't strain in the bathroom. Take your time waking up in the morning. These aren't difficult things. They just require a little bit of awareness and consistency. Think about it this way. You lock your doors at night to protect your home. You wear a seatbelt to protect yourself in the car. This is the same kind of thing. You're just protecting your heart during its most vulnerable time of day. And look, I get it. Change is hard. You've been doing your morning routine the same way for probably 30, 40, 50 years. It feels automatic. But automatic isn't always safe, especially as our bodies age and change. You know your body better than anyone else. If something feels off, if something feels different, if you notice any of those warning signs we talked about, don't ignore it. Talk to your doctor, get checked out. It's not being paranoid, it's being smart. One last thing I want to mention, if you have heart disease, if you've had a heart attack or a stent or bypass surgery, if you have high blood pressure or diabetes or high cholesterol, this information is even more important for you. You're already at higher risk. Avoiding that morning bathroom strain isn't optional for you, it's essential. But even if you don't have any diagnosed heart problems, even if you feel perfectly healthy, this still applies to you, because the research shows that many people who have sudden cardiac events in the morning had no idea they had any heart issues. They felt fine. They thought they were healthy. Prevention means protecting yourself before problems start, not after. So here's what I want you to do tonight before you go to bed. Put a glass of water on your nightstand. Set your alarm 15 minutes earlier than usual to give yourself time for that gradual wake-up. And make a decision that tomorrow morning you're going to do things differently. You're going to drink that water first thing, you're going to wake up slowly, you're going to be gentle with yourself, and you're going to pay attention to what your body is telling you. These 15 minutes could honestly change everything, because what we're really talking about here isn't just avoiding one specific problem. We're talking about respecting your body, understanding your risks, and taking simple protective steps that let you live longer and healthier. Your heart has been beating non-stop since before you were even born.